And now I'd like to invite Catherine Madden, the Executive Director of Kidney Cancer Canada, to the podium for the closing remarks for today's conference.
Hi, everyone. All I can say right now is, wow, what a day it's been. I have, for the last 7 months, had the privilege of serving as Executive Director of Kidney Cancer Canada, and this has been an incredible day for me in terms of new knowledge, meeting a lot of you folks. And that really makes a big difference because it's very different when you can come face to face with the people that you're working for and helping, and the people who are helping each other. So I say thank you to all of you for participating today, because it's been an absolute pleasure to have you here, and I hope that you've gained something from today. So I just wanted to wrap up today and talk about the power of people. Because that's what KCC is about. As Deb said, it started in a waiting room with patients wanting to do more for patients. And we've really maintained that over 5 years with this organization. And I want to start off with a quote, and much of this I actually shared with our board last night. We had our annual meeting, and this was what we talked about, because this is what KCC is about today, and this is about what KCC envisions for our future. We have a new vision. We developed that in early January at a strategic planning session, and our new vision is to improve the lives of Canadians affected by kidney cancer. Pretty simple message, and we do that in a variety of ways. We do it through advocacy, we do it through education on days like today, we do it through supportive research, and we do education and support in general in the community through our website, our discussion forum, in a variety of ways. So teamwork is the ability to work together toward a common vision. It's the ability to direct individual accomplishments towards organizational objectives. It's the fuel that allows common people to attain uncommon results. This is our KCC Board, Kidney Cancer Canada Board, supported by, as I said, myself as the Executive Director, and we have a part-time administrative coordinator in the province of Quebec. The rest of those folks in that picture, we're missing one board member from Newfoundland. That was our group in January at our strategic planning session, and they give a great deal of volunteer time. So they are the people who are helping to lead this organization and create the vision and mission and strategic plan to move this organization forward. Who else is part of our team when we talk about teamwork? Well, you. Every one of you here is part of our team. In a variety of ways, you serve as volunteers, you serve as messengers, you provide support to people on our discussion forum. So you're part of our team, and we need you to know that we need you to be part of that team. We're not playing football like Deb talked about, but our challenge is even greater. So when we talk about what impact we have, we talk about charities and the fact that charities have to be fiscally responsible and they need to deliver programs. But for us, those outcomes that a lot of people in our sector talk about, those outcomes have faces. They are the people in this room. They are the patients, the caregivers, the family and friends. So when we're looking at what impact we have, we look at the fact that we provide hope, awareness, equitable access, knowledge, empowerment, and education. And those are important things for us to be sure that we're creating that impact in your life, not just delivering what we think is important, but we're getting feedback from you folks in terms of impact, where people are saying they're doing fundraisers for us and creating awareness, and they're amazed at the number of people who are supporting and jumping on the bandwagon, so to speak. We've got people talking about our website and the support and information that they found there. We've got people talking about the impact that our work, our discussion forum has, and being able to reach out and talk to somebody else who understands the journey that you're on, whether you're a patient or a caregiver or a family member. So my question to all of you is, have we had an impact on you? Hopefully today we've had an impact on you, and we're letting you leave with a bit more knowledge. You've met some new friends, some people that are going to be able to be part of your support team who you'd never met before, but will form the basis of who you are and how you share your story moving forward. If we've had an impact on you, I'm hoping you're saying, so how can I help? How can we help? How can we help this organization? Well, there's a couple of definitions I wanted to share with you. The first is champion. A champion is a person who fights for or defends any person or cause. They're a fighter or a warrior. An ambassador is an authorized messenger or representative. And philanthropy, it's altruistic concern for human welfare and advancements, usually manifested by donations of money, property, or work to needy persons, by endowment of institutions of learning and hospitals, and by generosity to other socially useful purposes. Or it's defined as the activity of donating to such persons or purposes in this way, to devote one's later years to philanthropy. And we don't need you in your later years. We need all of you. You can come in your younger years, your later years, your middle years. We don't discriminate. Philanthropist, then, is a person who practices philanthropy. We need you. We need you to give of your time, and there are a variety of ways that that can be done. As I mentioned, we have volunteers who help deliver information. We have volunteers who help put on educational conferences across the country and in their provinces. We have people who participate on the discussion forum, provide that peer-to-peer support where we can align somebody who's going through a similar circumstance or who is of a similar age or gender, who can talk to you through the discussion forum or offline in a private conversation. We need your talent. If you're creative, if you have website skills, if you want to help us develop new materials that you think we need and we're missing, and primarily we want to create more material around that first stages 1 through 3, because we do have a lot of content that refers to that stage 4 metastasized disease. We need more materials for stages 1 through 3. We also need material for caregivers and younger caregivers. We're seeing a second generation of caregivers now, the children of people who are living with kidney cancer, who want to get involved and do something, who know that they can't necessarily support at home as caregiver number 1, but they want to give back or be involved or know how to support their family as they're going through this journey. We need your resources. What does your company do? If you provide a service that we could benefit from and you want to give of your time and talent through that, we're good. Sorry, Deb, you're laughing, but I'm bold. So what service could you provide? How might you help us? Could you advise us? Could you set us up with the right person to talk to develop a new website? Think about the ways that you can create impact that don't have to involve stuffing envelopes if that's not your thing. Create awareness for us. There's a variety of ways to do that. We're tweeting, we're twits, we're on Facebook, we blog on WordPress, follow us, retweet us, share us on your Facebook page with your friends. Wear your green bracelet so when somebody says, oh, what's that one for? You can tell them what that one's for. Take our newsletter with you. Leave it in your doctor's office. Leave it at the library. Just leave it lying around. Somebody else will pick it up. Read it first, though, because there's some great content and some great stories in there and some great opportunities for awareness. We've had some people do some really creative fundraising things for us lately. We have a young lady from Western University who decided to sell green T-shirts on St. Patrick's Day and got her friends to rally around the concept of staying hydrated in the university setting. But it worked. She raised $2,000 for Kidney Cancer Canada like that and had a blast doing it. Thank you. We have other people in there who've done a basketball tournament in memory of a gentleman who passed away from Kidney Cancer Canada. So we're not asking you to think outside the box or do something like the Boston Marathon. We're asking you to just think about how you might make a difference and what hobby of yours you might turn into a fundraiser or an opportunity for awareness, even if it doesn't raise funds. If you play euchre with a group, talk about KCC, talk about kidney cancer, create that awareness for us because you can be the best champions and ambassadors that we have. We're a limited number of people with a limited budget, so it's sort of along that line of, you tell 2 friends, who told 2 friends, who told 2 friends. Then it starts, it becomes viral. Oh. Fundraising, we've talked about it. Every idea counts. Every dollar counts. And as you heard, every dollar that's raised for research with Kidney Cancer Canada gets matched 100% by the government. So why not create that opportunity to double your dollar and let the government step in and help us out? So do what you love. Like I said, if you can turn a hobby into an opportunity to create awareness, we'd love that. So be a Kidney Cancer Canada ambassador, champion, and philanthropist. Make our story part of your story. So then we can all work together to develop that chain of information. And when you talk about the 6 degrees of separation from you to someone else, if you tell 2 friends and they tell 2 friends, you're up to about 62 people, I think, by my count. So it's easy. It's really easy to make our story part of your story. So thank you to our volunteers, as I said earlier, particularly Joan, who helped really spearhead this committee for today's event. Joan works tireless hours on behalf of Kidney Cancer Canada, and certainly we really appreciate all that you do for KCC, for the board. It's a pleasure to work with you, and I know the team who supports you in this event couldn't do it without you, and we appreciate all of you who supported that event today. Thank you to our speakers and our special guests. We really had some exceptional people here with us today with some great knowledge and a variety, right from your diet to surgery to treatment of side effects. So we really hope that we touched on all of the things that are touching your life right now in some manner. And again, that information is all going to be uploaded to our website within the coming weeks, so you'll be able to watch that information and again share it out with your family, help them better understand, or the people in your life, what's going on and what kidney cancer is all about for you. Thank you to our board of directors. They guide this organization, as I said. They spent 2 days in January and helped develop a strategic plan that will direct this organization for the next 5 years. We're only 5 years old, so to be looking at the next 5 is exciting. It's a next really big step for us, but we hope that you'll be on that journey with us, and that the next time we have this conference, it'll just get bigger and bigger and bigger. Thanks to every one of you, because without you, there would be no need for KCC. I wanted to end with a quote. Never doubt that a small group of thoughtful, committed people can change the world. Indeed, it is the only thing that ever has. And that's what KCC and this family and community that we've created is all about. And we are making a difference. You are making a difference. And we are improving the lives of people living with kidney cancer and the people who love them. Thank you.